Imagine waking up in the morning and feeling that familiar pull in your lower back, a quiet resistance between your intention to move and your body's hesitation to cooperate, a reminder that pain is not an enemy shouting at us, but a signal speaking in a calm, persistent language, asking to be understood rather than ignored. The lower back is not weak by nature. It is intelligent, adaptive, and deeply connected to how we live, sit, breathe, think, and respond to stress. When we talk about 10 minutes of lower back stretches, we are not talking about quick fixes or magical movements, but about giving the nervous system a short window of safety, allowing muscles, fascia, and joints to remember their natural rhythm and elasticity. Pain relief begins not with force, but with permission for the body to slow down, to release guarded tension, and to restore communication between brain and tissue. From a scientific perspective, gentle stretching stimulates mechanoreceptors in muscles and connective tissue, sending calming signals to the spinal cord and brain, reducing the threat response that often amplifies pain. Philosophically, those 10 minutes are an act of respect toward the body, a quiet acknowledgement that healing does not require. Lower back pain is often misunderstood as a sign of weakness, damage, or failure within the body. Yet from a scientific and neurological perspective, it is more accurately described as a protective message generated by a highly intelligent system designed for survival. The human nervous system is constantly scanning the body and environment for signals of safety or threat, and the lower back, positioned at the structural and functional center of the body, becomes a frequent focal point for the surveillance. When the brain perceives instability, prolonged stress, poor movement patterns, or even emotional overload, it may increase muscle tension and sensitivity in the lower back as a way to limit movement and prevent perceived harm. This response is not random. It is learned, adaptive, and rooted in millions of years of evolution, where protecting the spine meant protecting life itself. Pain, in this sense, is not evidence of something being broken, but evidence of something being guarded. Muscles tighten not because they are weak, but because they're trying to create artificial stability when the nervous system feels uncertain. Over time, this guarding becomes habitual, and the brain begins to associate ordinary movements with potential danger, amplifying pain signals even in the absence of tissue damage. Scientific research increasingly shows that many cases of chronic lower back pain cannot be explained by imaging findings alone, as people with visible disc changes often experience no pain, while others with normal scans suffer significantly. This discrepancy highlights that pain is not solely a mechanical issue, but a perceptual one, shaped by neural interpretation, memory, and context. The body remembers past strain, long hours of sitting, sudden injuries, emotional stress, and even fear of movement, and it encodes these memories into protective strategies that manifest as stiffness and discomfort. When we label the lower back as weak, we reinforce a narrative of fragility that further heightens the nervous system's vigilance, creating a feedback loop where fear leads to tension leads to pain, and pain reinforces fear. From a biological standpoint, the lower back is designed to be resilient, adaptable, and capable of handling varied loads, but it requires regular movement and reassurance to maintain this resilience. Pain emerges when the system believes that its capacity has been exceeded or that unpredictability poses a risk. This belief does not have to be conscious. It operates beneath awareness, shaping muscle tone, movement patterns, and pain sensitivity. Understanding pain and protection changes the entire approach to relief, shifting the goal from forcing the body to comply toward teaching it that it is safe to relax. Gentle stretching plays a crucial role here, not because it lengthens muscles alone, but because it provides non-threatening sensory input that updates the brain's assessment of danger. Slow, controlled movement stimulates sensory receptors that communicate position, pressure, and motion, helping the nervous system recalibrate its expectations. Each stretch becomes a form of conversation, where the body tests movement in a controlled environment and learns that nothing harmful occurs. Over time, this reduces the need for protective tension, allowing muscles to soften naturally rather than being forcibly pulled into flexibility. Philosophically, this reframes pain not as an adversary to defeat, but as information to interpret with patience and curiosity. When individuals stop fighting their lower back and instead listen to it, they often discover that pain fluctuates with stress levels, fatigue, and emotional states, revealing the deep integration between mind and body. This insight fosters compassion toward oneself, replacing frustration with understanding, which in itself has measurable effects on pain perception. Neuroscience shows that feelings of safety and control reduce activity in pain-processing regions of the brain, while threat and helplessness amplify them. Thus, approaching lower back pain with gentleness is not passive. It is strategically effective. The protective nature of pain explains why aggressive stretching or pushing through discomfort often worsens symptoms, as the nervous system interprets force as confirmation of danger and responds with increased resistance. In contrast, slow, mindful stretches performed within a comfortable range send the opposite message, reinforcing the idea that movement can occur without harm. Over repeated sessions, this reshapes neural pathways, decreasing sensitivity and restoring confidence in the body's capabilities. The lower back begins to release not because it has been conquered, but because it no longer needs to defend itself. This process takes time, but even brief daily practices can initiate change, as the nervous system responds more to consistency than intensity. 10 minutes of gentle movement can be enough to interrupt long-standing protective patterns, reminding the body that it is supported, capable, and safe to move. In this way, lower back pain becomes a doorway to deeper awareness rather than a permanent limitation, revealing how profoundly the body works to protect us, even when that protection feels uncomfortable, and how relief emerges when we align with that protective intelligence instead of resisting it, allowing the system to gradually lower its guard and rediscover ease through trust, repetition, and a renewed sense of safety that unfolds slowly within the tissues and the mind as the body relearns. That movement is not a threat, but an expression of balance and continuity within a system that is always listening and adapting, waiting for reassurance rather than force to guide it back toward equilibrium and comfort through subtle signals that accumulate quietly over time as a protective response softens, and space begins to return where tension once dominated, and the dialogue between sensation and awareness continues without needing to reach a final point because healing itself is in ongoing conversation that remains open-ended and alive rather than concluding with a fixed destination or definitive end. Breath-guided, slow movements restore circulation, joint health, and muscular balance by aligning the mechanical actions of the body with the regulatory rhythms of the nervous and cardiovascular systems. From a scientific perspective, breathing is one of the few physiological processes that operates both automatically and voluntarily, making a powerful bridge between conscious intention and unconscious regulation. When movement is synchronized with slow, steady breathing, the body receives a unified signal of safety and coordination, allowing multiple systems to work in harmony rather than in competition. In the context of lower back care, this harmony is especially important because the lumbar region is not an isolated structure, but crossroads where muscles, joints, fascia, blood vessels, and nerves converge to support posture and motion. Slow, breath-guided movements encourage the diaphragm, pelvic floor, and deep abdominal muscles to function as an integrated unit, subtly improving spinal stability without excessive effort. As breathing deepens and lengthens, intra-abdominal pressure is regulated more efficiently, reducing unnecessary load on the lumbar spine and distributing forces more evenly through the trunk. This redistribution is not something that can be forced through strength alone. It emerges naturally when breathing and movement are allowed to coordinate. Circulation improves as muscles alternately contract and relax in a rhythmic pattern, acting like a gentle pump that assists blood flow back toward the heart. Improved circulation delivers oxygen and nutrients to tissues that may have become undersupplied due to prolonged sitting or chronic tension, while also facilitating the removal of metabolic byproducts that can irritate nerve endings and contribute to discomfort. Joint health also benefits from slow, controlled motion, as synovial fluid, the lubricant of joints, is circulated more effectively when joints move through comfortable ranges. This nourishment of joint surfaces supports long-term resilience and reduces stiffness, particularly in the small joints of the spine that rely on movement rather than blood vessels for nutrition. Breath-guided motion also influences the elasticity of connective tissue, which adapts gradually to sustained, gentle tension combined with relaxation. Fascia responds not to abrupt force, but to slow loading that allows it to reorganize and hydrate, improving its ability to transmit force smoothly across the body. From a neurological standpoint, coordinating breath with movement enhances proprioception, the sense of where the body is in space. As attention is directed toward inhalation and exhalation, awareness naturally broadens to include subtle shifts in posture and muscle tone. This heightened awareness refines movement patterns, reducing compensations that place uneven stress on the lower back. Muscular balance begins to reemerge as overactive muscles are allowed to release and underactive muscles are gently re-engaged without strain. The nervous system favors efficiency, and when breathing and movement are synchronized, it can distribute workload more evenly rather than relying on the same muscles repeatedly. This rebalancing process reduces fatigue and lowers the likelihood of recurring pain. Philosophically, breath-guided movement represents a return to an intuitive way of moving that predates modern exercise culture, when a body was guided by sensation rather than external metrics. It encourages patience, as progress is measured not by intensity but by quality and ease. This patience has biological consequences, as the nervous system requires time and repetition to adopt new patterns. Each slow repetition reinforces coordination between breath and movement, gradually establishing a baseline of calm efficiency that carries into daily activities, such as standing, walking, and bending. Over time, the lower back experiences less unpredictable stress because movements become smoother and more evenly distributed. Emotional tension also softens during breath-guided stretching, as slow exhalations activate neural pathways associated with relaxation and emotional regulation. This emotional softening further reduces muscle guarding, creating a positive feedback loop where physical ease supports mental calm and vice versa. Importantly, this approach does not demand flexibility or strength as prerequisites. It meets the body where it is and works with existing capacity. The cumulative effect of these practices is not dramatic in a single session, but profound over time. As circulation improves, joints remain nourished, and muscles regain their natural balance without coercion. The lower back becomes less a focal point for strain and more of a conduit for efficient movement, supported by coordinated breathing that continuously informs the nervous system that the body is organized and capable. In this state, movement feels less like a task to complete and more like a fluid expression of balance, where breath leads motion and motion reinforces breath in an ongoing cycle that sustains comfort and resilience without demanding a final outcome or a defined end, allowing the practice to remain open, adaptive, and responsive to the body's changing needs as time progresses and awareness deepens through repetition rather than resolution. Consistent short routines retrain the brain to perceive movement as safe again by leveraging the nervous system's preference for familiarity, repetition, and gradual exposure over intensity or force. From a neurological perspective, the brain is constantly predicting outcomes based on past experiences, and pain often arises when these predictions anticipate threat. If certain movements have been associated with discomfort in the past, the brain may begin to flag them as dangerous, triggering protective responses such as muscle tension and heightened sensitivity even before movement occurs. Short, repeatable routines provide a controlled environment in which these predictions can be gently challenged and updated. By engaging in daily or near-daily movement that remains within a comfortable range, the individual sends repeated evidence to the nervous system that motion does not inevitably lead to harm. Over time, this evidence accumulates, reducing the brain's tendency to overestimate risk. Scientifically, this process reflects neuroplasticity, the brain's ability to reorganize itself based on experience. Neural pathways that once amplified pain can weaken when they're no longer reinforced, while pathways associated with calm, coordinated movement become stronger. The key to this shift lies not in dramatic effort, but in consistency, as the nervous system prioritizes patterns that are repeated reliably. Short routines are especially effective because they are less likely to trigger fatigue or fear, both of which can reinforce protective responses. When movement feels manageable and predictable, the brain remains receptive to new information. This receptivity allows subtle improvements in coordination, timing, and muscle activation to take place without conscious effort. Each session becomes a rehearsal of safety, where the nervous system practices allowing movement rather than bracing against it. Importantly, the benefits of consistency extend beyond the duration of the routine itself. As the brain becomes more confident in the body's capacity to move without injury, it reduces baseline muscle tension throughout the day, improving posture and reducing unnecessary strain. This ongoing reduction in guarding lowers the threshold for pain, meaning that everyday activities become more comfortable without requiring constant attention. From a physiological standpoint, repeated gentle movement improves circulation, joint lubrication, and tissue hydration incrementally, supporting the structural health that reinforces the brain's sense of safety. Psychological factors also play a critical role in this retraining process. Consistent routines foster a sense of agency and predictability, both of which are powerful modulators of pain perception. When individuals know what to expect from their movements and feel in control of the process, the brain interprets the situation as less threatening. This sense of control counteracts feelings of helplessness that often accompany chronic pain and can amplify it. Over time, the routine itself becomes a signal of safety, as the nervous system associates the familiar sequence of movements with relief rather than discomfort. This association can trigger relaxation even before the movements begin, further reducing pain sensitivity. Philosophically, short daily practices shift the focus from achieving a perfect outcome to cultivating an ongoing relationship with the body. This relational approach encourages patience and self-trust, acknowledging that change occurs through steady engagement rather than sudden breakthroughs. Such patience aligns with the biology of learning, as neural adaptation unfolds gradually and requires reinforcement. By keeping routines brief, individuals are more likely to maintain them during busy or stressful periods, preserving continuity that will be lost with more demanding programs. This continuity is essential, as lapses in movement can allow protective patterns to reassert themselves. Short routines also reduce the emotional burden associated with exercise, reframing it as a supportive habit rather than an obligation. As confidence grows, the nervous system becomes more flexible in its responses, allowing a wider range of movements to feel safe. This expansion often occurs spontaneously, as people find themselves moving more freely in daily life without consciously trying to do so. The brain's updated predictions begin to generalize beyond the routine, influencing how it interprets novel or previously uncomfortable movements. This generalization is a hallmark of effective retraining, indicating that the nervous system has integrated a message of safety at a deeper level. Over weeks and months, the cumulative effect of these brief, consistent practices can be substantial, transforming the experience of movement from one of caution to one of trust. The lower back, once guarded and sensitive, becomes less central to attention as it no longer demands protection. Instead, it integrates seamlessly into coordinated movement patterns supported by a calmer nervous system. In this way, consistency becomes a true catalyst for change, not because it forces adaptation, but because it provides a steady reassurance the brain needs to relax its defenses and allow movement to unfold naturally within a framework of familiarity and safety that continues to evolve without requiring a final endpoint or definitive conclusion, remaining an open process of learning and adaptation rather than a finished state to be achieved. 10 minutes of mindful stretching functions as both a scientific intervention and an act of self-respect because it addresses the body not as a machine to be fixed, but as a living system that responds to attention, consistency, and care. From a biological perspective, even brief periods of intentional movement can initiate measurable changes in the nervous, muscular, and circulatory systems. When stretching is approached mindfully, with awareness of breath and sensation, the brain shifts from a state of urgency to one of observation. This shift reduces the dominance of stress-related neural pathways and allows regulatory processes to take precedence. Pain perception is closely tied to context, expectation, and emotional state, and mindful stretching alters all three simultaneously. By choosing to spend 10 minutes listening to the body rather than ignoring or overriding it, the individual sends a powerful signal that their well-being is a priority. This signal has physiological consequences, as feelings of care and safety reduce the neural amplification of pain. Scientifically, mindful attention enhances interoception, the brain's ability to sense internal states. Improved interoception leads to more accurate interpretations of bodily signals, reducing the likelihood that benign sensations will be misread as threats. As awareness increases, movements naturally become more refined, avoiding extremes that could trigger protective responses. Muscles respond by relaxing where tension is unnecessary, and joints move more freely within comfortable ranges. The circulatory system benefits as gentle movement increases blood flow without provoking stress, supporting tissue health and recovery. Over time, these small physiological improvements accumulate, reinforcing the nervous system's confidence in the body's resilience. Beyond these measurable effects, mindful stretching carries a philosophical dimension rooted in self-respect. In modern life, the body is often treated as a tool to be pushed, optimized, or ignored until it demands attention through pain. Setting aside 10 minutes for mindful movement challenges this paradigm, reframing the body as a partner rather than an obstacle. This reframing changes the emotional tone of movement, replacing frustration and impatience with curiosity and acceptance. Such emotional shifts are not abstract. They influence neuroprocessing by reducing threat perception and increasing tolerance for sensation. When individuals approach stretching with respect rather than force, they are less likely to cross thresholds that reinforce pain, allowing progress to occur without setbacks. Mindful stretching also fosters a sense of continuity between mental and physical health, highlighting their interdependence. Calm attention supports smoother movement, and smooth movement reinforces calm attention, creating a feedback loop that sustains well-being beyond the stretching session itself. This loop explains why people often report improved mood and mental clarity after even brief periods of mindful movement. The act of pausing, breathing, and moving gently interrupts habitual stress patterns, offering the nervous system a reset that can influence the rest of the day. From a learning perspective, mindful stretching teaches the brain how to regulate intensity, promoting adaptability rather than rigidity. The brain becomes better at modulating muscle tone and movement strategies in response to changing demands, reducing the likelihood of overuse or strain. This adaptability is a hallmark of healthy systems, enabling them to absorb stress without breaking. The self-respect embedded in mindful practice also strengthens adherence, as individuals are more likely to maintain routines that feel supportive rather than punitive. 10 minutes becomes sustainable not because it is easy, but because it is meaningful. Over weeks and months, this sustainability allows cumulative adaptations to take hold, enhancing mobility, reducing pain, and increasing confidence in movement. Importantly, the value of mindful stretching is not confined to physical outcomes. It shapes how individuals relate to discomfort more broadly. By observing sensations without immediate judgment, people learn that discomfort can be temporary and manageable, reducing fear-based reactions. This learning generalizes to other areas of life, supporting resilience in the face of stress. In this sense, mindful stretching becomes a micro-practice of self-regulation, teaching skills that extend beyond the body. The scientific and philosophical aspects converge in the realization that healing does not always require more time or effort, but more presence. 10 minutes of mindful stretching exemplifies how small, intentional actions can align biology and values, creating change that is both measurable and meaningful. Rather than striving for an endpoint, the practice remains open-ended, adapting to the body's needs and circumstances, reinforcing the idea that well-being is an ongoing process shaped by daily choices and gentle attention that continues to unfold without finality or closure, sustained by respect, awareness, and a quiet accumulation of moments where the body is met with care rather than demand.